Dr. Michael Enns here again. I want to give you some information on headaches, whether it's general tension headaches or general headaches, migraine type headaches. Now, to help understand where headaches come from, one way I like to look at it is, in a sense, there's part of the brain that has to deal with controlling and managing pain. This part of the brain, located in the brainstem, acts like a thermostat. So what happens is, when there's enough bad things going on, and we'll talk about what those bad things are in a second, but enough bad things that are going on that raise the temperature, if you want to call it, until it hits a certain threshold here. When you hit that threshold, the headache or the migraine, or we call it aura, the symptoms prior to the severe pain developing, start to go off. If the temperature continues to rise, you may get another threshold up here where it triggers into a full-blown migraine headache. So majority of people that I see can't identify any clear triggers. Sometimes it's obvious things like premenstrual migraines can be caused, but often there's things that they're not quite sure what is the trigger. But there's about 4 things that make up the majority of the, if you want to call it, the temperature rise. And it's not just one thing, but it's a combination of these things. On a simple level, it's the sleep, it's stress, and it's exercise or lack of exercise. So, in particular, sleep. It's both getting enough sleep and getting good quality sleep. In children, almost all headaches that I see are related to getting inadequate sleep. Occasionally it's interrupted sleep, but most children have no time sleeping and staying asleep, but they don't get enough sleep, especially as they get into middle school and teenage years. They have more social pressures of going out and staying up late on Friday and Saturday night and sleeping in on the weekends, and then having to change during the school week to get up early in the morning. So one simple remedy for that is you have to get up the same time every day, at least for a trial for 2 weeks. I'll say try this for 2 weeks. Most teens aren't going to want to do this forever, but at least try for 2 weeks, and they can demonstrate to themselves, hey, this does make a difference. So getting up every day at the same time. The other thing is, if you need an alarm clock to wake up, your body wanted more sleep, so you know you have to go to bed sooner. If you're going to bed at 9, you still, at 6 o'clock you wake up. One is you may be behind on sleep and you're catching up, but you're probably tired. You may have to go to bed at 8. Some teenagers need actually 11 hours of sleep a night. I had one of my patients who had migraines several times a week, had seen multiple specialists, was a baseball player. It turned out, in taking a history, he needed actually 11 hours of sleep a day. And we were able to calculate that based on how many hours he used to catch up on Saturday and Sunday when he slept in. When we divided that out, it was 11 hours a day. He needed that consistent schedule, getting this consistent amount of sleep. When he did that, he was a baseball pitcher at the time. He said, I've never thrown, not only do I have no headaches, my headaches went completely away, but I also have never thrown a baseball harder before. There also can be quality of sleep. There can be other things such as restless leg syndrome, interrupted sleep, sleep apnea, other things that can affect sleep, and there can be things that wake people up at night, a partner who may be snoring that may cause interruption with sleep. It may be the fact that you're a new mom and you're waking up several times at night to help take care of a child that's ill or a newborn. So, talking about sleep, now we're talking about stress. My simple definition of stress, it's anything that interferes with healthy living. So that can be changing schedule, so you can't get a consistent sleep schedule. It can be real stresses such as an illness in the family that you have to take care of, or more time at work to cover for somebody who's on vacation. Stress because you have in school and you're trying to study for exams and trying to squeeze in work schedule along with studying. So that can cause stress and make it harder to exercise and harder to get the consistent meals. Stress can be skipping breakfast or skipping lunch or skipping dinner. Again, that goes under the category of stress, anything that, and again, interferes with healthy living. And then the third thing that affects this is exercise. People who are getting regular exercise tend to have fewer headaches. those who, when you're getting less exercise or more sedentary, again, that raises the temperature. You may say, well, I haven't been changing in my exercise, but you may be hovering just below the threshold here. And then now stress comes, and now you have not enough sleep and skipping meals, and suddenly that can trigger. So hopefully these things will help you manage your headaches and have fewer headaches. If you have any more information and want to discuss this more, you can please contact me.